Good morning. I'm Lisa Delarianda, and I'm with Palm Beach County Public Affairs. And the purpose of this news conference this morning is to address two topics. Dr. Alina Alonso with the Palm Beach County Health Department will be discussing health issues. And Mr. Ed Bradford, the Director of Mosquito Control, will be discussing mosquito control. Thank you. Dr. Alonso?
Good morning, everyone. First of all, thank you very much for all of you showing up. You are our voice out to the community, and we really appreciate you being here to help us get these messages out. Our number one concern since before the storm started, obviously, is the health and safety of all our residents in Palm Beach County. We have been monitoring very closely all the activities going on that are health related, and we want to share some of the prevention messages to continue to keep the citizens here in Palm Beach County safe and to make sure that they don't have any problems, and if they do, they can call us and we can help them. We have been monitoring for diseases through our syndromic surveillance system that we have in place, and this basically takes data from the hospitals and the emergency rooms, and we have not seen any indication so far of any widespread diseases or any outbreaks. That is very good. And I think this is a tribute to the messages that we've been able to get out from the very beginning of the storm, and that we will continue to put out to the public so that our population can stay safe. The number one concern at this point continues to be the stagnant water that is surrounding our homes. This of itself can cause many problems. The first one is the composition of that stagnant water that is surrounding us, and we need to assume that that contains decomposing organic material as well as waste and chemicals from the ground. This odor that's in the water will continue to be very unpleasant, and until all the water completely dries and the sunlight and the natural decomposition process takes place. So because of the water intrusion into some of the homes, they also have to be worrying about mold. If there's a limited amount of mold in your home, you can take care of it using 1/4 cup of bleach into a gallon of water and clean up small areas. But if you have large intrusion or a large amount of intrusion, then you may seek professional help. There are companies that actually do mold remediation, and you may want to seek professional help. There will also be organic materials due to sewage. We have septic tanks in many of the areas, dead carcasses in the water, and this is going to be laying outside your homes. There is cleaning of using lime to put on sludge to clean that up, which can be purchased at hardware stores, feed stores, nurseries, and you pour the lime on it. All these instructions are on our website of how to do this. There's detailed brochures that explain step by step on how to do this. The amounts, you don't have to memorize what I'm saying. It's all written out for you. If you go to our webpage, I'm going to repeat it a couple times, www.pbchd, in other words, is the letters for Palm Beach County Health Department, so pbchd.com, and there's a banner, it says Isaac post-storm, and there's buttons for each one of these items that I am talking about. The other problem is folks who are on septic tanks. When the floods and the septic tanks will not work properly, you want to use as little water as possible in your home so that it doesn't back up into your home. And then once the grounds dry out, then you're going to be taking care of your wells. You should not be drinking water from your wells because, again, we're going to assume that the water has contaminated your wells. There's a process, again, detailed in our website of how to decontaminate your well. And then after you do that, you should get your wells tested so that you can confirm that you've done the process correctly. There are multiple labs that provide this service for you here in Palm Beach County, And again, there's a list of those labs on our website that you can go to if you need recommendations as to which ones to pick or to call. The other issue that we're obviously going to have is with stagnant water comes mosquitoes. And the mosquitoes lay their larvae in the standing water, and then after a few days they start hatching. There have been swarms of mosquitoes hatching, and that's why we have mosquito control with us. And we're going to begin doing some spraying. We're going to talk more about that. But the health concern about the mosquitoes, the main message is prevention. You want to stop the mosquito from biting you. And in order to do that, the best thing that you can do is to wear long sleeves and long pants and use insect repellent that has DEET in it. Again, this is all outlined on our website. Once the waters recede, check your grounds, check your property, and make sure that there's not buckets or pots, toys that are left with stagnant water in them, because that's the breeding ground for the mosquitoes. The other piece to this is to know the symptoms. If you have diarrhea, if you have nausea and vomiting, perhaps the water that you've been drinking has affected you, of course you should seek medical attention from your physician. Or you can also call the health department. We'll be happy to help you to answer any questions that you may have. The main number that we've been utilizing is the EOC number, 712-6400. Did I get that right, guys? Okay, I don't want to give out the wrong number. 712-6400, and then you ask for the health desk, and they'll put you in. I have staff there staffing it throughout the weekend, so that you can ask us calls that, or questions that you may have. The other piece that some question that you may have is about West Nile virus. I know people are very nervous about this. What we do in Palm Beach County is we have 7 areas where we have chickens, and these chickens serve as sentinels. And what we do is we bleed those chickens because the mosquitoes bite the birds. And then the virus is transmitted to other mosquitoes when they bite that bird that has the virus in them. And then, of course, then the mosquito can bite a human. I get bit. I'm the first person to get bit by any mosquito that's within a mile, so maybe I should be a sentinel human. But we have been keeping track of this, and we have not had any chickens with West Nile virus yet, so that is very good for the county. But we want to keep it that way, so we want to definitely get rid of any standing water and get rid of all those larvae so that we don't have any in Palm Beach County. We have had the St. Louis encephalitis virus up and around, and so we're very aware of that, and that can make people sick with more of fever, aches and pains, and most people only have that small mild, but in some cases, in 1%, there can be more neurological problems that can occur. So it's serious in the sense that you need to pay attention and try not to get bit by the mosquitoes. So again, all this is on the website. Take your time, go on the website. There are PDF files that you can download. I have an example of one right here. This talks all about mold and how mold needs moisture to grow. And it's nice, it's simple, it's easy to explain. Has some very good information there for your home. If you want to get a better picture of that, I'll hold it up for you. And so, again, there's lots of resources on there that you can utilize to go and look up more information. So, in concluding, I'll just tell you we will be still available at the 712-6400 to answer any of your questions that you may have. But take these messages and try to do prevention, because it's a lot easier to prevent something than to treat it after you get sick.
How you doing today? I'm Ed Bradford, Director of Mosquito Control. Palm Beach County Mosquito Control will begin aerially spraying 270,000 acres of the western communities from Military Trail to the Glades tonight after dusk to reduce existing mosquito populations. This will be followed up by an air spray the middle of next week to target adult mosquitoes that will continue to hatch from the standing water and reduce the risk of disease transmission. Future air sprays aren't determined at this time, but can be monitored by calling our air spray hotline number, which is 642-8775. This will give you updates and areas to be targeted in the coming weeks. Our ground trucks will be larviciding thousands of mosquito breeding areas east of Military Trail in the coming weeks to prevent emergence of mosquitoes. Also, our ULV trucks will be adulticiding neighborhoods east of Military Trail again. This will be after dusk in an effort to prevent potential disease-carrying mosquitoes from biting the residents. Homeowners can access our website at pbcgov.org and click on the Report Mosquito Activity drop-down. This will enable them to pick up tips on reducing mosquito exposure around the residents or allow them to request service when high mosquito activity occurs. I guess in conclusion, I don't want to get too long-winded here. You know, much of our activities will be based on the amount of mosquito larvae out there, the instars they're in, and factors such as this. So in conclusion, any questions regarding our aerial spraying, residents can contact EIC at area code 561-712-6400. That will be this holiday weekend. They can begin contacting our mosquito control office on Tuesday. We're open Monday through Friday, but Tuesday we come back from the holiday between the hours of 7 and 3:30 at 967-6480. This way they can get other detailed answers to their questions about mosquito control activities. It'll probably just be a generic staff on this weekend, but for more detailed questions, by contacting our home office, not only can they get answers to their questions, but they should also be able to leave us any requests for services of mosquito activity.
Are there any questions?
Question for Ed about, you know, talking about emptying standing water in flower pots and whatnot in the yard. A lot of the people in acreage especially are dealing with water just completely surrounding their homes, a lot more than just a flower pot. What are the recommendations for those people who really, you know, can't do anything about that water right now?
They're probably, to be honest, in the same boat we are. When there's that much standing water, about all we can even do, because it's such a vast area, is let the adults hatch out. We are monitoring the adults, the larvae instars, and we're going to try and time our air sprays out. So the key here, I mean, with this much water, you're going to have a lot of mosquitoes, let's face it. It's going to be a continuous hatch off. It's not going to be one big hatch as a result of this. So we have to let them hatch off, and we'll try to time our air sprays as to reduce their numbers and also break that disease cycle so that we don't get that started. Most of the tips in regard to homeowners is designed for areas where you don't have the flooding, obviously. And I guess if you're out there, the only thing you can do is to let us know if you are experiencing something unusual. And again, every little bit helps. I mean, like I said, there are flower pots, there are containers that do contribute to what they're experiencing. So the tips do follow, but I think probably the biggest thing you could tell them is use DEET. Protect yourself if you're going to be outside, especially without having electrical services. Obviously, you're not going to have air conditioning. Many people might not even have screens on their houses. So do use DEET and be diligent about it if you're going to be exposing yourself.
If I may add something, in terms of the protection at this point for your scenario that you're talking about, where there's huge flooding still around, the prevention is really avoid the mosquito bites. So if you can wear long sleeves and pants, that's very helpful. Also, I hope people are using something to wade through that water, because that water's really nasty now, and it goes back to my prevention issues in terms of the water. You have to assume that the water is contaminated. So if you do wade through water, make sure as soon as you come in that you wash off, you take a shower with soap and water so that you can decontaminate. If you have any sores or anything like that, make sure that you sterilize those sites so that you don't get infections from the standing water, because you have to assume that they're contaminated.
And
The screen's very important in the homes.
one other just follow-up for you, Ed. The spraying technique that's going to be used tonight at dusk, is that going to be the same kind of technique that's used next week when you go out and do it again, or is it something different, or?
No, we have a contract with Howell Brothers Enterprises. They have been spraying here in Palm Beach County for over 20 years, over 25 years actually. And they're familiar with all the areas. It will be after dusk. Right now, we're basically limiting it to west of Military Trail, which is 270,000 acres. For one thing, it takes the entire night to spray that big of an area. Most of the areas we feel confident right now that we can target them with our ground trucks at nighttime to knock down that. If we find out that there is a threat of disease, because you are talking about a lot of mosquitoes and a lot of other factors that go into whether you have a disease outbreak or not, then we do have the capability to fly east of Military Trail should we need to do that. But at this point, we feel pretty confident between our larviciding activities and our ground trucks that we should be able to keep that down to a minimum.
The spraying tonight, is that going to be aerial spraying?
Yes, it's aerials with a helicopter, a Huey helicopter, and it will be, like I said, targeting 270,000 acres west of Military Trail.
What kind of insecticide would they be spraying?
It's a dibrom 14, it's an organophosphate, it's rapidly biodegradable, it is put out with a high pressure system which produces microscopic droplets. About 99% of the droplets are so small they only impinge on a mosquito. They're designed to float through the air about ground level. They're not designed to drop onto the ground. If they're dropping onto the ground, they're too large. But the idea is to kill the mosquito, stay airborne. It begins breaking down within about 2 hours, and by the next morning it's pretty much 100% degraded. It's not I think that's one misconception. I hope to get this out to people, is that it doesn't have any residual activity. By that it means it's not like a chemical that's sprayed in your house for fleas or roaches or anything like that. It doesn't have any residual value. It's a contact kill, and the reason for that is because there are many, we do it after dusk because that's when the mosquitoes are most active, and also you avoid the beneficial insects such as bees, butterflies, some of your insects such as this, and you don't want that residual activity to kill any of those beneficial insects. So that is one important part of the program.
What should people be doing during the spraying? Should they be inside? Can you remind folks on what to do during the spraying?
I would recommend stay indoors if possible, and by that I say if you have a medical condition. Other than that, I know there's a lot of youth baseball, soccer games, football games, concerts, all these activities that go on. We've been spraying now with the same product, same basically application techniques for 30 years with very, very few, if any, incidents. The only, actually in the last 30 years, the only incident I can ever recall was somebody getting stinging sensation in their eyes. But if you feel you're chemically sensitive or you do have asthmatic conditions, I would recommend just stay indoors during the spray. We do publicize this. We do a press release. I mean, it's very well publicized to the general public. So if you are aware that we are going to be doing a nighttime air spray, just stay indoors. It takes us about 4 hours to do the entire air spray. It'll make a quick pass over your neighborhood. Our swath widths are about 10,000 feet apart, so you might not even know that they're targeting your area. And the idea is for the chemical to drift those 2 miles to the next pass. So.
Did you say ground spraying is planned or is not at this time?
Ground spraying with our trucks will begin, next week. The trucks are very effective in urban areas. From the point of release of the chemical, it will drift about 300 feet. That's why trucks really aren't very effective out west, because of the 5-acre lot. Even a 2-acre lot is much, the houses sit back so far that the chemical will never drift back there, and obviously you can't be driving it up and down everybody's property. You would never be able to finish it, and it's such a large area. But they're very effective in the urban areas, and that's why we use the trucks and are able to utilize them along the East Coast.
More questions?
Question for Dr. Alonso. children like to play in the standing water that's out in the acreage and maybe lots of hatchy places like that. Is that more and more of a risk as time goes on after the...
It's a very big risk. The question is that kids love to play in standing water, and I totally understand. I've been dragging my kids out of there since before the storm, even they got the idea. So it's not worse as time goes by. It's very dangerous from the first day. In addition to the contaminants that we know are in the water, there's also broken glass, nails, items that you don't know are there because the water is covering. So it's very, very dangerous to let your kids, and the first thing they do is they take off their shoes, right? Mm-hmm. No kid plays in the water with shoes on. So it's very, very dangerous, and it will lead to cuts that then can get infected. Tetanus, make sure that they're up to date on their vaccines. And then just the other danger that has been very real and we have actually seen is that people then stepping into something that's on the ground or stepping into a deeper area and then falling into above their head because they didn't see the canal, or they didn't see the pond, or they didn't see an item that's on the road or on the side. So very, very dangerous from day one.
Have you had any reports of incidents from the emergency rooms, et cetera, of people getting sick from just being in the water?
We have not seen that spike up yet. So I think that because of your help of getting these words out, that people have now heard that every storm, we always put that out and tell people not to do it. And the few cases that we saw, the skier, for example, skiing down the road, the news media immediately said that that's not a good idea to do that. Thank you for asking that question. That's a good one.
See, a lot of folks have asked us, or at least me, if they can do anything about that smell. Is there anything they can do, or is this kind of a...
This is Mother Nature being very nasty to us right now, and like I said, until that decomposition cycle takes place, it's too large to try to get rid of with anything that you would add to it.
A couple of residents that we spoke with are opting not to use their septic tanks, not to flush their toilets, so they're finding other means on their property or whatever to take care of that. That also poses, I believe, a health risk. What are your recommendations to those people that aren't flushing their toilets, but they're still obviously having to go?
Well, they're dumping it to the rest of the neighbors because right now the other problem is that it's flowing in some areas. In some areas it is not flowing, it is very stagnant. So, that sewage out in the open is a problem. Nature will take care of it eventually, but in the meantime, hand washing, body washing would be the recommendation if you're in contact with any of that water.
And the last question I have is just about in certain areas there's been large amounts of fish or other animals in certain canals, and that water just isn't moving, obviously. Do they call the health department or the county about that, or what do you suggest people do if their backyard is filled with a dozen or 5 dozen dead fish?
Fish and Wildlife could get that question. My concern is the health concern with that, and again, it will decompose, but it smells very, very bad. So don't try to do it yourself or clean it up because then you're going to get contaminated with that water. So from the health perspective, if you stay away from it, it won't hurt you. We've also had, in addition to fish, we've had hundreds of birds. The young birds that aren't flying yet, as the hurricane came through, it killed many, many birds. So there's been hundreds of birds found also dead. And usually what they do is they just let nature take its course and they decompose and they flow back into the cycle of life.
This is maybe a dumb question, but I know that the really strong odor can make you maybe sick to your stomach, but can it actually make you sick if it's persistent for a long period of time?
No, just stay downwind and get away from it.
You guys have tested the water that's out and about, not just in the wells. In terms that maybe...
No, we have not tested the water.
Oh, you haven't tested the water that's...
No, we don't test the water. We make the assumption that it is contaminated.
So in terms that, say, a 6th grader would understand it, once you go out and play in that water, you as a mom, what would you say to that kid?
I grab my child by the ear and I drag him back in and I say, that is dangerous. Do not do that. The same as you would if your child was playing with matches. It's very unsafe. And again, it's not just the contamination of the water. It's the other items that are in the water. There's moccasins, there've been alligators. It's just not safe. So grab the kid by whatever you grab them, and maybe it's a good time to sit down and do a little lecture on prevention and a little bit of health. And you can download some of the information that we have and might help you have that conversation with them. Who knows, maybe you'll turn into a good biologist.
Anyone else?
Any other questions? Well, thank you so much for coming. Thank you for doing the media, because like I said, you are our voice, and you can get this out to folks and communicate these messages. Remember that we have the web page. Turn that in, and thank you very much for keeping the community safe.
Thank you, and I would just like to also thank our news partners for sharing the information and continuing to scroll our Emergency Information Center's number. That's 561-712-6400. Thank you.